Hello, welcome to Coding Medical Coding Training. Today, in this video, we are going to see an important convention, ICD 10 CM convention, which is excludes 1 and excludes 2. Excludes 1 and 2 are coding conventions in ICD 10 CM. This convention applies to all codes in the ICD 10 book. Excludes 1 and 2. There are two types of exclusion classifications that flag potential conflicts in coding. These notations are critical to understanding why certain codes on a claim may be considered incompatible by payers, resulting in denials. So let us get to know this a little bit better. I've often been asked to explain the difference between excludes 1 and excludes 2. So remember, excludes 1 is a strict no. Just don't code these together. In the screenshot, you can see some examples of excludes 1. I've taken the example of E10, a type 1 diabetes mellitus. For E10, what are the codes which are excludes 1? Diabetes mellitus due to underlying condition, for which you should be using the code E08. Drug or chemical induced diabetes mellitus, which is E09. So for these you should not be using the code E10, and also E10 and E08 will not come together on a claim. The patient cannot have these two conditions at the same time. So you should take care to read all the excludes 1 condition when you're picking a code from the tabular list in the ICD-10 book. So in this example, you can't report codes in category E10, like E10.10 describing type 1 diabetes mellitus with ketoacidosis without coma, with the codes listed in the excludes 1 note. See, certain conditions cannot occur together, like acquired versus congenital conditions. See, a patient will have either an acquired condition or a congenital condition. So to understand it better, let us take an example. A patient is born without his hands, both the hands, left and right. So that is a congenital deformation present at birth. Whereas a patient undergoes a surgery to remove the right arm. So now he does not have the right arm. It has been removed through surgery. So absence of the organ, right arm, that is an acquired condition. It is not a congenital condition. So hope you understand the difference between acquired and congenital. They cannot occur together in a patient, in the same patient, for the same organ or structure. Malignant versus benign lesions, that is another good example. If a lesion or tumor is found in a patient, you determine whether it is cancerous or non-cancerous, either benign or malignant. A lesion cannot be malignant and at the same time benign. Chronic versus acute conditions. So this has a certain bit of gray area. Anyway, remember that chronic and acute conditions do not come together. So in this slide, you can see an excludes 2 example. D24, which is benign neoplasm of breast. So the excludes 2 conditions are adenofibrosis of breast N60.2, benign cyst of breast is N60, benign mammary dysplasia is N60, Benign neoplasm of skin of breast is D22.5 or D23.5. Fibrocystic disease of the breast is N60. So that is the excludes 2 for D24. The excludes 2 codes you can report with the codes under the category for benign neoplasm of breast, because the conditions excluded aren't part of the condition represented by the code. You can report both codes together if the patient has both the conditions. These include the codes for adenofibrosis of breast, benign cyst of breast, and fibrocystic disease of the breast. So in this example, you can report code D24.1, which is a benign neoplasm of the right breast, with the codes listed in the excludes 2 note. So in the rare case scenario, when the patient has both these conditions, that is the main term, benign neoplasm of breast D24, and also the terms under the excludes 2 together at the same time, you can report both together. Coming to excludes 1. So D29.1 is a benign neoplasm of the prostate. Here you have excludes 1 N40.0, benign prostatic hyperplasia without lower urinary tract symptoms. Then you have excludes 1 N40.1, benign prostatic hyperplasia with lower urinary tract symptoms. Excludes 1 again N40.2 is nodular prostate without lower urinary tract symptoms, and excludes 1 N40.3 nodular prostate with lower urinary tract symptoms. So the code range N40 represents enlarged prostate. So that is different from the benign neoplasm of the prostate, which the code will be D29.1. They are entirely different conditions, disease conditions. So you should not report D29.1 along with N40 category. So excludes 2. You can see a picture of the urinary bladder. Then the ureter, that is the urethra, which is surrounded by an enlarged prostate. Excludes 2 actually represents not included here, as an excludes 2 note indicates that the condition excluded is not part of the condition represented by the code. But a patient may have both the conditions at the same time. Then you are allowed to code both the codes together. So when an excludes 2 note appears under a code, it is acceptable to use both the code and the excluded code together when appropriate. So not included here, but both conditions can be coded together. So here in this example, a calculus in the urethra N21.1 and has an excludes 2 note for calculus of the prostate N42.0. So this means you can quote both the conditions if the patient has both a urinary and a prostate calculus. So you would use both the codes separately. So a calculus is present in the urethra as well as in the prostate. And the patient has both these conditions at the same time. So can these codes be coded together? Excludes 1 and excludes 2. For example, if you take F17.210, it has a excludes one for personal history of nicotine dependence. F17.210 is current nicotine dependence. So that is cigarettes, the form of nicotine cigarettes. And the excludes one is personal history of nicotine dependence. That code will be Z87.891. So F17.210 and Z87.891 cannot come together. You will find this excludes one node under Z87.891. So under Z87.891 you have a excludes one for F17.210. Okay, F17.210 actually means the patient is currently using cigarettes. Z87.891 means the patient had a history of nicotine dependence and now is stopped. So both cannot occur together. Excludes one indicates the two conditions listed together on a claim. They are mutually exclusive and should not be coded together. So this can occur when a claim includes two codes for the same condition, with one code being more specific version of the other. So for a same disease condition, when you take two codes, overlap, the codes will be overlapping. So that is not allowed. Example, G89.4 versus G89.29. So G89.29 is for the other chronic pain. Example can be used for conditions like chronic back pain that isn't a result of something like a specific injury or a disease that has its own code. When using this code, an additional code may be needed to specify the nature or the location of the pain. G89.4 is chronic pain associated with significant psychosocial dysfunction. Example, anxiety disorders. So in this case, G89.4 is more descriptive, more specific than G89.29. So including both the codes on the same claim would trigger an excludes one denial, as the system recognizes that only one of these codes should be used to describe the patient's condition. You cannot use a vague code and then a code again which explains a little bit more, which is more specific. So you are just overlapping. It becomes redundant. Two codes are not needed there. Just one code is sufficient. Sometimes, in some cases, a claim may trigger a excludes one and excludes two denial. So you will have a dual denial. How do you deal with it? In some cases. So for example, opioid abuse. F11.1 and then F11.2 is opioid dependence, and T40.0 poisoning by adverse effect of underdosing opium. So here you have F11.1 and F11.2 would conflict because F11.2 is more descriptive version of the F11.1, leading to an excludes one denial. However, the combination of F11.2 and T40.0, while less common, could be relevant in certain cases, such as a patient being both opioid dependent and experiencing an adverse effect from the underdose of opium. So in this case, you can appeal the excludes two denial by providing detailed documentation to support the claim. But you should never use F11.1 and F11.2 together. That is excludes one. Excludes one here for H05.30, unspecified deformity of the orbit, that is the eyes. So here the excludes one is Q10.7, which is congenital malformation of the orbit. So here it is unspecified versus congenital. The patient is born with the condition. So that is a congenital condition. Whereas here the deformity is not specified well enough. So this is an excludes one. So this is a case, typical case of excludes one. Like this is the case of the acquired versus the congenital form of the same condition, and this can never be reported together. An acquired condition is something which the patient acquires during the lifetime, whereas Q10.7 is a congenital condition which is present at birth. So they can never be reported together on a claim. They are mutually exclusive. They can't exist simultaneously in a patient, in a single patient. Hope this is clear for you in the concept of excludes 1 and excludes 2 so far. So giving you more and more examples so that you understand excludes 1 and excludes 2 thoroughly. So if you take chronic sinusitis, code category is J32, which requires fourth character addition. When you look below, you have the fourth character J32.01, then you have 2. So it depends on the site of the sinusitis. Either it is maxillary sinus which is affected, or frontal sinus which is affected, or ethmoidal sinus which is being affected. So the fourth character specifies which sinus is being diseased. Here you have an excludes 2 note. In the ICD 10 CM, reminding us to quote acute sinusitis if present and documented, list the acute condition first, followed by the chronic condition. So there is also a note to code additionally any known infectious agents B95 to B97 if documented. Sometimes a chronic condition turns acute for the patient. Another good example is asthma. Finally, coders can always resort to varying the doctor about excludes 1 and excludes 2 conditions. If there is any gray area, if there is ambiguity, feel free to clarify with your provider. You can raise a query in the appropriate manner. Example, E88.1 is lipodystrophy, which is not elsewhere classifiable NEC code. You have an excludes one for E88.1, which is Whipple's disease. So the code for Whipple's disease is K90.81. So if the provider mentions lipodystrophy and you have a query in your mind about whether it is Whipple's disease, you can clarify, place a query and clarify. So hope you all found this video very useful, and if you want more explanation about any difficult topic in ICD or CPT, feel free to contact me. See, you can call the number or even WhatsApp me. Thank you. See you soon.